2004, most recent specialty. Specialty of dentistry and a discipline of radiology, so it's a subspecialty of radiology. This is oral and maxillofacial radiology, concerned with the production and interpretation of images and data produced by all modalities of radiant energy, and I'll explain that in a minute, that are used for the diagnosis and management of diseases, disorders, and conditions of the oral and maxillofacial region. So it's all imaging modalities. What are some examples of imaging modalities? Of course, like the intraoral radiograph, regular small films that your dentists use, the extraoral films like a panoramic radiograph if you've ever had one taken, and then there's digital imaging using X-rays. But then there are other imaging modalities like magnetic resonance imaging, which doesn't use ionizing radiation. All of them have a relevance to diseases of the maxillofacial complex, and those diseases are quite unique because one of the main reasons is that a lot of them are odontogenically related. That is, they're either diseases of the teeth or diseases related to tooth-forming tissues that remain in the jaw. And it's interesting that the medical profession is very uneasy looking at diseases of the jaws because they are so unique and so on. So there really is a place for for maxillofacial radiologists and the specialties. The patient doesn't come to the radiologist. The patient is referred by another dentist. So the patient doesn't decide when they need a radiograph. It's the dentist that decides. And that decision is based on clinical need. It's when the referring dentist suspects there's some hidden in the jaws or the teeth. That hidden disease can be a cavity that the tooth is is bothering the patient, but he doesn't see anything wrong, or it could be some swelling in the jaw, possibly a tumor that you can't see, but you can see the effects of it. So you take a radiograph when you suspect there's hidden disease that you can't see, hidden or occult disease. So you start with a clinical exam, and based on clinical need, then you take a radiograph, a dental radiograph. And in dentistry, you don't take radiographs just for screening. In other words, you don't take a radiograph to see if something is wrong. You take a radiograph because you suspect something is wrong. That radiographs are taken only on the basis of clinical need. And that's how you talk to a patient. If a patient says, "Why do I need these radiographs?" You say, first of all, I can't do a good diagnosis without it. I guess there's two aspects maybe that stand out. One is that it became recognized as a specialty. It's the most recently recognized specialty in dentistry. And the second thing was the change in imaging, that is the movement to digital imaging, and more recently the dissemination and use of dental cone beam three-dimensional computed tomography. So I would say the fact that it became a specialty, and also that the imaging techniques developed remarkably in a very exciting way, and that's still going on at the moment. I think for some time it's going to move along the way it's moving now. That is, the advanced imaging techniques like cone beam CT will find its way into the general dental profession. I mean, it's in most specialties use it now. Although not everyone in the specialty. I mean, endodontics, maybe 50–60% of endodontists use cone beam CT, for instance. High resolution, limited field of view cone beam CT, just like one arch at a time. But general dentists are getting into it also, and that presents a challenge for the profession, and will be a challenge for some years. That is to educate the dental profession on the proper use of this very powerful imaging technique, and to educate them on every dentist on the responsibility that comes with it, and then to be there when a dentist sees something that they don't understand or can't interpret, so that we're there to view it, interpret it properly, and write a report so the patient's welfare is protected, and of course that way the dentist, referring dentist who sent me the CT scan, he's legally and ethically fulfilled his obligations. So I don't see necessarily great changes in imaging for some time. In fact, cone beam CT, I think the resolution is about as high as it's going to get for a limited field of view machines that endodontics. I chose maxillofacial radiology or dental radiology because, to my mind, it's the most cerebral of all the professions. I'm a physicist also, and I'm not sure you know that or not, but yeah, I have a PhD in physics, and that's where I started. And physics is a cerebral profession. You're always using deductive reasoning and thought processes and so on. And maxillofacial radiology emphasizes thought processes, diagnosis, for instance, as opposed to emphasizing technical skills. I practiced private dentistry for 15 years, and I enjoyed it.